Metformin is a Biguanide oral anti-diabetic drug. So, introduction, it is a Biguanide drug orally given 500 mg thrice daily, given in case of diabetic mellitus type 2. Main actions are it decreases the hepatic gluconeogenesis, decreases the glucose absorption in the intestine, increases the glucose uptake in the skeletal muscle. Now, coming to the mechanism of action, in case of liver, this metformin decreases the ATP production. When ATP production is decreased, adenylate cyclase is also decreased, which decreases the phosphokinase A. Ultimately, decreases the hepatic gluconeogenesis. The first point is clear, right? By the decreasing ATP, it decreases the hepatic gluconeogenesis. Coming to the second point, that is skeletal muscle and the adipose tissue, it increases the activation of AMPK. By the AMPK activation, there will be increased glucose uptake in the skeletal muscle and decreased glucose absorption in intestine, right? So this point 2 decreases the glucose absorption in the intestine. The point 3 increases glucose utilization in the skeletal muscle is caused by AMPK activation. So in mechanism, remember two things. In case of liver, it decreases the hepatic gluconeogenesis by decreasing the ATP production. And in case of skeletal muscle and adipose tissue, we all know it increases the glucose uptake and utilization by increasing the activity of AMPK. Now coming to pharmacokinetics, it is given orally 500 mg thrice daily. Well absorbed orally, T half is 3 hours, duration is 8 hours. Excreted unchanged in urine. Coming to pharmacological actions, again AMPK activation decreases postprandial blood sugar. Advantages of metformin, it decreases the intake of food. That means it leads to weight loss. So it is ideal in case of obese individual with diabetes mellitus type 2. And also it decreases VLDL, which improves the lipid profile. Less side effects, and it is non-hypoglycemic drug, whereas other oral anti-diabetics like sulfonylureases are the hypoglycemic drugs. If you administer that drug in patients, it can cause hypoglycemia, but this drug metformin do not cause hypoglycemia even if you administer at high levels. Coming to the adverse drug reactions, it causes nausea, vomiting, bloating, abdominal pain, anorexia means inability to eat, and diarrhea. And also due to the malabsorption, we have said, right, it causes malabsorption. We mentioned earlier, right, it causes decreased glucose absorption in the intestine. So because of this malabsorption, prolonged use of this metformin leads to vitamin B12 deficiency. And also rarely it can cause lactic acidosis. Due to the accumulation of this lactate, it can cause lactic acidosis, which is serious condition because it can cause respiratory distress, hypotension, hypothermia, and also ultimately leads to death. So it is contraindicated in type 1 diabetes, alcoholics, hepatic, renal, respiratory, cardiac diseases patients. Coming to drug interactions, cimetidine, furosemide compete with metformin. Whenever some drugs compete with each other, what happens? The duration of action of the drug increases, right? So it leads to delayed excretion, leading to the toxicity.